Welcome to our channel, Kidney Saver Healthcare. This is the best channel for information about health. Today, we will talk about a topic that is very important. We have talked a lot about what is creatinine GFR in the blood. Today, we will talk about urea or blood urea nitrogen. What is this? And is it better to check the level of urea in the blood than someone who has kidney disease, or creatinine is a better marker? First, understand that blood urea nitrogen is also a waste product, like we eat protein, meat, chicken, lentils, etc. At the end of that, nitrogen is made as a waste product. Protein breakdown occurs in amino acid. Nitrogen is made from amino acid. Now, nitrogen is converted into ammonia, and it is very toxic for the cells. So there is a urea cycle in the kidney, so it converts it into urea. Urea then goes to a special level in the blood, and then the kidneys take it out. So if there is kidney disease, it will come out less like creatinine, and its level will increase. So this will also indicate in a way that someone does not have kidney disease. But it does not only increase in kidney disease. There are many other conditions in which the level of urea can increase. For example, if someone has severe dehydration or if there is a lack of water, then the level of urea may increase a lot as a result. Hypovolemia can also affect the kidneys due to dehydration. As a result, both urea and creatinine will increase, but sometimes only the level of urea can increase in dehydration. There can be no damage to the kidneys, so it is not that specific for the kidneys. Similarly, some people take steroids. The level of this can also increase as a result of steroids. Sometimes there is bleeding in the stomach, which we call GI bleeding. There is gastric ulcer or peptic ulcer disease, as a result of which there is bleeding. There are blood clots or black spots. So even in this, the breakdown of nitrogen in the gut, the level of urea can increase. Apart from this, by taking more protein intake. If you take too much protein intake, then urea has to be formed in the breakdown. So just by taking more protein intake, the level of urea can also increase. Apart from this, in some people who have sepsis or infection or high catabolic state, we have also seen that the level of urea, it increases when the kidney does not have any damage. In heart disease, urea, CHF, congestive heart failure can increase. And sometimes its level can be abnormally low. Like if a person has drunk a lot of water, then it will go down. If the protein diet is less, if there is malnutrition, then it will go down. In pregnancy, its level goes down. So the important point to understand here is that creatinine is a better test. It is more specific. Only indicates kidney damage, whereas urea, I have told you 6 more conditions in which urea level can increase. Now, the question arises that what to do if someone has a very low level of urea. It may be due to overhydration and drinking too much water. So it should reduce the intake of water. If it is due to malnutrition and it has taken less protein, then it should take a little less protein. Like in many old people, nursing home residents who do not eat, who do not have teeth, or are old age, it can affect their level in this way. Its significance is more important if its level is high than what to do. Now, in high, it depends on the condition. If someone is a bodybuilder and takes a lot of protein and he needs to work on his protein intake, then the level of urea will be fine. Whereas in this, the kidney will not have any special damage. Will like this video, so it is not necessary that the level of urea increases. It means that the kidney is damaged. This can also increase without kidney damage. That is why when as a nephrologist, we have to select a test from urea creatinine, which we monitor. So we monitor creatinine more because it does not affect the rest of the things. If someone takes a lot of protein, then we will tell him to work less on his supplements. Its level increases in dehydration, so you will drink more water. If a patient comes in summers and he has drunk less water, then his level of urea will be more. So we will tell him to take more water intake. Now, another important thing in this is that this is also the marker of kidney disease. If someone has chronic kidney disease, then you must have seen that urea and creatinine increase simultaneously. In that condition, when creatinine is also increased, then elevated urea also means that your kidneys are more damaged. Even though we calculate GFR, we calculate the function of the kidney. We do it on the basis of creatinine. But you will see that it has increased simultaneously. If someone has 1 creatinine, so its normal level is between 10 to 20. Now, there's also a difference between them. One is urea, and the other is blood urea nitrogen. The urea range is different between 20 to 50 in blood, and the blood urea nitrogen range is between 10 to 20. Blood urea nitrogen means that the urea, which is carrying nitrogen. So as the creatinine increases, the level of urea or blood urea nitrogen also increases. Like if creatinine is 1 to 2, urea and nitrogen can be 20-40%. And if creatinine is 3%, then it can be 60%. So the levels of both increase. Many people ask about kidney function, kidney disease, treatment, etc. So the same treatment that is of elevated creatinine, LOGFR, kidney disease, that also helps urea. The only difference is that sometimes it happens that creatinine does not increase, but urea increases. So then, as a doctor, I will see all those things that the patient did not get dehydration. He is not taking too much protein. He is not taking steroids. There is no infection. There is no bleeding in the stomach. Many times we see in ICU, in the morning, the labs come. If the creatinine is 1, then it is 1, and the level of urea is 70. So when we dig, it is known that the patient has also had bleeding of blood, etc. So in this way, urea has to be assessed. That's why it is big. As more factors come in it, then it becomes a little less important as compared to creatinine. And it will also work the same things that will work creatinine. If you take less protein, as we say in CKD that you have to take less protein, your GFR will be better, creatinine will be better. In the same way, urea will also be better in it. I have already told that this is also a waste product of protein. And creatinine is also a waste product of protein. Both are produced in the end result of protein. The only difference is that urea increases in some other things too, in which normally creatinine does not increase. Apart from this, there are many other tests like cystatin C. There is another test. It is new. It does not even happen in Pakistan. So now we rely on creatinine and GFR. So in this video, I have told you about what is urea, what is blood urea nitrogen, how it is produced, what are the causes of its increase and decrease, what is its normal level, and what is its treatment. Treatment is to treat the underlying kidney disease. If someone will be treated for CKD due to kidney stones, because urea will increase in it, due to sugar or blood pressure, due to polycystic, then he will be treated. So the treatment has to be done for the underlying cause. But if the underlying cause is not the increase in urea, then the rest of the factors, like taking steroids or bleeding in the stomach, have to be treated. I had not made a video on blood urea nitrogen earlier because it was a little tricky. But many people have asked, what is urea? What is blood urea nitrogen? How it increases? What to treat? So I wanted to make a small video so that you also have an understanding of this. So I hope you will like this video. Please subscribe our channel if you need more information for